Hello, my name is Acosta and I will be doing my presentation on agoraphobia. I will be using my flashcards as a reference. Agoraphobia is an anxiety disorder. It's often referred to as the fear of going outside, but that is incorrect. Agoraphobia is the fear of being in situations that may cause an individual to panic or have a panic attack. It's the fear of being in a situation where escape is either problematic or embarrassing for the individual. It's just fear of having a panic attack in a place that a certain individual is afraid of being in. 4.8% of the population has agoraphobia, and 3.2 million people in the U.S. have it. Situations that agoraphobics try to avoid, it can be anywhere. Agoraphobics it's different for the individual. It's just anywhere that causes them to panic or have a panic attack or makes them uncomfortable or causes them to have anxiety. It could be in a car, a bus, a train, an elevator. It can even be their own home. Agoraphobics can't be afraid of being in their own home. It's just whatever place causes them to have anxiety. The main places that agoraphobics, the popular places that agoraphobics are afraid of being is in public places, crowded places, places with large spaces, and also places like a mall or a store. Those are the main places that agoraphobics try to avoid. The cause of agoraphobia is unknown, but it is known to be passed on through genetics. So if your mother has agoraphobia, there's a high chance that you may inherit it and you might develop agoraphobia as well. There are many theories. One theory is that it develops in response to repeated anxiety-causing situations. There's the mental health theory that says it's caused by how we respond to unresolved Oedipal conflicts. Also, it's known to be caused by substance abuse, drug and alcohol abuse. Also, medications for sleep cause agoraphobia, such as benzodiazepines, which are also used to treat agoraphobia, but there's a catch to it. It can either cause it or prevent it. So, yeah. Also, having traumatic childhood events that can cause agoraphobia, and also it's a complication of panic disorder. So, if you have panic disorder and you have complications with it, agoraphobia is what may develop from that. What are the symptoms of agoraphobia? The main symptom of agoraphobia is having a panic attack. A panic attack accompanied by fear, chest pain, dizziness, trembling, loss of breath, faintness, and sweating. Other symptoms include avoiding places, depending on others to do simple things like going grocery shopping, because you need someone to be with you because of your fear of being in that place. Also, you can't be alone. If you're afraid of being alone, that's a symptom of agoraphobia. Also, feelings of hyperreality and derealization, being uncomfortable in public places, and also having an unusual or increased agitated temper. Risk factors. There's several risk factors, or many risk factors for being agoraphobic. Having panic disorder or generalized anxiety disorder or social anxiety disorder, any of those is a risk factor. Suffering traumatic life events such as sexual abuse or physical abuse as a child is a risk factor. Also, being a woman is a risk factor. Women have a higher percentage of being diagnosed with agoraphobia than men do. Being Native American, being middle-aged, widowed, or divorced is a risk factor. Coming from a low-income population and having a history of agoraphobia is a risk factor as well. Complications and consequences of having agoraphobia. Agoraphobia can result in the total loss of your social life. It can greatly and severely limit your life events. You can become housebound for years just because of your fear of not wanting to go outside because of having a panic attack. It can develop thoughts of depression, suicidal thoughts, and even increase your anxiety by far more. It can cause individuals to turn to substance abuse, alcohol abuse, just to cope with their feelings. It can increase the likelihood of other anxiety disorders to develop, and it can severely harm you mentally. To be diagnosed with agoraphobia, you have to meet the criteria. The two main things are you have to have an intense fear of having a panic attack, and also have an intense fear of, or not an intense fear, but you have to have an avoidance of going places that you fear. Um, you must have a physical exam. It must be examined by a doctor to rule out other things because agoraphobia has common symptoms with other anxiety disorders or other disorders. So a doctor has to rule that out. Um, you have to make sure that the symptoms are from agoraphobia, and doctors have to make sure that it's not caused by other medication. Because if you're on medication and some medication can cause these symptoms that are similar to agoraphobia, but it's not agoraphobia. It's just an effect from your medication. So you have to have a doctor rule all of their options out and pin it exactly on agoraphobia. Agoraphobia is treated in many ways, but the two main ways is with psychotherapy and drug treatment. One of the most popular ways is cognitive behavioral therapy with regular visits to a mental health professional. In these sessions, the the therapist will try to focus on decreasing the negative anxiety provoking thoughts and trying to help the individual conquer it. Also, self-exposure is a popular way to treat agoraphobia. You just try and expose yourself to the place or the situation that you're afraid of being in and try and conquer it. You just try and expose yourself to it. Usually when people do this, they're accompanied with friends or their therapist just to have a person to help them feel comfortable and relaxed. Um, so self-exposure is a helpful way. Also, drugs. The main drugs used to help with agoraphobia are SSRIs, which are selective serotonin reuptake inhibitors, and SNRIs, serotonin norepinephrine reuptake inhibitors. And also, like I said earlier, benzodiazepines are used, but the catch is that they can also worsen this person's symptoms and can it can either help it or um, make it worse. So that's the catch with benzodiazepines. Alternate treatments include going on dietary and herbal supplements. Also, some roots and crops can help with agoraphobia, such as kava, which is a root that's located in the Western Pacific. It's the catch with the kava is that it causes liver damage, so people don't really use that. Exercise is a good help. Exercise helps all anything that has to do with either stress or anxiety, so that's a help with agoraphobics. Hypnosis is known to help, and also meditation, yoga, being in calming, relaxing places is a good help for agoraphobics, and also special therapy such as aromatherapy and relaxation therapy. How to live with agoraphobia. The main thing to do with agoraphobia is you can't let it own you. You have to confront your fears and you have to try and conquer them. You can't let them own you. You should practice going, like I said earlier, self-exposure. You should practice going out with a friend or a therapist and try and just expose yourself to it so you can slowly conquer it. It's going to take time. It's not going to happen quickly, but if you do it enough, you'll get to the point where you can conquer this and you can hopefully get rid of the agoraphobia. You can learn relaxing and calming skills, relaxation practices like relaxing thoughts when you are out. Just remind yourself of the relaxation things that you know, and that can help. Joining support groups is a main help for agoraphobics because they find comfort knowing that there are people like them who have similar fears and that they're not alone. So that's a help with agoraphobics. How to live with agoraphobia? You have to live a good lifestyle. You have to avoid substance abuse and drugs and alcohol. You have to take your medication as directed, and you just have to live a good, clean, healthy lifestyle. And those are the main ways that you can live with agoraphobia and treat it and try and conquer it. And that is my presentation. Thank you.